I call to order this meeting of the Health, Environment, and Community Engagement Committee. My name is Cam Gordon. I'm chair of the committee, and I'm joined today by council members Fry, Andrew Johnson, Glidden, and Kano. We are a quorum of the committee. There's just two items that we have to take up today, one consent item and then a discussion item. And we want to hear all about the Rethink Your Drink campaign and get a presentation. But before we do that, I will move the consent item, which is authorizing agreement with the Center for Climate Change and Health to accept $30,000 to address public health and climate change in Minneapolis. Is there anybody who wants to discuss that or pull that item off consent? Seeing none then, all those in favor, please say aye. Aye. Any opposed, say no. That motion carries then. And then we're ready for our presentation and discussion for today, which is Rethink Your Drink campaign presentation. And I think Ms. Vasani is going to start that. If you're ready, we're ready for you.
Can you hear me?
Yes,
okay?
And you don't have to be too close. I think it confuses the system, so just be comfortable where you are. And
I just read the sign, sorry.
Okay, that's all right.
Good afternoon, Mr. Chair. My name is Vish Vasani. I'm a public health specialist with the Minneapolis Health Department, and I coordinate the Rethink Your Drink Every Sip Counts campaign. And though this project is supported by the Minneapolis Health Department, it's been made possible through Statewide Health Improvement Program, or SHIP, funding from the Minnesota Department of Health. So to begin, obesity is a problem that Minnesota can't ignore. And according to a new report from the Trust for America's Health and the Robert Wood Johnson Foundation, rates of obesity have increased in 5 states across the country, and Minnesota is one of those states. At 27.6%, Minnesota now has the 36th highest adult obesity rate in the nation. Similarly, in Hennepin County, it's reported that 33% of adults are overweight, while 20% of adults are obese. These numbers are likely an underrepresentation of local data, so the percentages are probably a bit higher. And we know that obesity puts us at an increased risk for other health problems such as heart disease and diabetes. Sugary drinks are the largest source of calories and added sugar in the U.S. diet and are major contributors to rising obesity rates in both adults and children. Americans are consuming 300 more calories every day, and almost half of these extra calories come from sugary drinks alone. So I have with me this display board. And this is a display board that we take out into the community to show community members the amount of sugar that's in a lot of popular sugary drinks and to really help make what's invisible visible. So your body needs absolutely zero sugar. However, because of the food system that we have, you're going to get sugar in your diet. And the American Heart Association has put daily recommended limits for all age groups. So for an adult woman, your daily recommended limit is no more than 24 grams of sugar a day, which is about 6 teaspoons. And if you take a look at one sugary drink alone, this Sprite alone has 64 grams of sugar, which is about 16 teaspoons. So one sugary drink alone exceeds your daily recommended limit by at least 2 to 3 times. This is even more shocking when you learn that on average, on any given day, about half of the U.S. population consumes one sugary drink a day, and about a quarter consumes more than one. In addition, sugary drinks are the largest source of added sugar in the diet of our youth as well. The USDA estimates that children between the ages of 12 and 19 consume up to a gallon of pop a week, and that's just up to a gallon. And what that looks like is a little over 100 teaspoons of sugar a week. And you wouldn't serve someone that much sugar, you wouldn't sit there and eat that much sugar, but children are eating it in liquid form through sugary drinks. And in addition to this obesity crisis and sugary drinks' contribution to weight gain, there's a variety of reasons why the Minneapolis Health Department is addressing sugary drinks. First, when people think about diet, they tend to gravitate towards food, but beverages make up a big part of your diet as well. And what you drink can either positively or negatively impact your mind, your body, and your health. In addition, though all Americans consume sugary drinks, low-income communities and communities of color are more likely to regularly consume sugary drinks, and as a result of that, are at a higher risk for obesity and obesity-related chronic diseases. We also know through best practices that people respond better when you have a specific ask or a specific behavior change that you're asking of them. And in this case, the behavior change we're trying to achieve is encouraging people to rethink their drink choice, choose a healthier beverage over a sugary drink. And the relative ease and specificity of this change has made it easy for people and places to adopt and implement. And lastly, there's such a large focus on policy, systems, and environmental change approaches. And while that's important, it's sufficient, but it's not enough. And we know that we need a combination approach of both education and policy system environmental changes to really achieve the behavior change that we're looking for, which is, again, choosing healthier beverages. And lastly, it goes without saying that there are a lot of larger forces that we're up against as well. In addition to just a lack of awareness, there's industry and industry dollars, there's marketing, there's promotion, disproportionately to low-income communities, communities of color, and especially youth of color. Price, it's very cheap. Portion sizes, they've increased. And norms, it is the way it is. When you go to someone's home, there's this expectation that you're going to be served sugary drinks. So as a result of all of these factors, we developed a campaign known as Rethink Your Drink, Every Sip Counts, and there's two main components to this campaign. The main goal of it is to encourage not just people, but places as well, to rethink their drink choices and choose healthier options over sugary drinks. And to achieve this, first we want to reach people by going out into the community and conducting activities to raise awareness about the link between frequent sugary drink consumption and the negative health effects, but also promote healthier options. And second, we want to reach places by pursuing healthy beverage practices and organizations to help them create healthier beverage environments where adults and children spend their time. So organizations could be a place of worship, it could be a school, it could be a work site. One of our community partners is working with a funeral home. So the possibilities are endless when it comes to the organizations. We've engaged a lot of partners in our own enterprise, but you can see from this visual that we've engaged a lot of other community partners as well, from city employees at the city level by working with our wellness committee, all the way to restaurants, food shelves, the Minneapolis Park and Rec Board, and a wide variety of clinics, including all of the WIC clinics throughout Hennepin County. With a group of our partners, we created this look and feel of the campaign, which is Rethink Your Drink, Every Sip Counts. And in addition to providing technical assistance and support to all of our partners, we also provided them with material resources so they could go out into their communities and effectively implement this campaign. So examples of some of these resources include posters that were in multiple languages. We also have magnets, which are across the top. We have water bottles to help promote choosing water and achieving that behavior change. You can kind of see it in the back, but we also gave display boards similar to the one that I showed you here, beverage dispensers to help, again, promote water, and t-shirts as well. And essentially, all of our partners served as kind of the boots on the ground. You know, you give them the resources to really go out, tailor it to their own communities, and then implement it. So the collective impact of our efforts is something that was even surprising for us once we sat down and really looked at our reach and the visibility of this campaign. So in addition to more than 400 people in places signing up to participate in the campaign through our website, and in addition to more than 350 likes on our Facebook page, we've had a wide presence throughout the community as well. And when I say we, that includes the health department, but also mainly our partners. We've had a presence with Rethink Your Drink in more than 80 community events throughout Minneapolis. And At all of these community events, we would do interactive tabling. And what that really entails is not just passing out flyers, but really engaging community members through activities, a display board similar to the one I showed, having them taste test healthier alternatives such as infused water, giveaways, playing games, sugar shot games. These events ranged from small scale, so specific to communities such as Minneapolis Urban League Family Day, the Minneapolis Public Schools Barbecue, school-specific events, and wellness and health fairs, all the way to really large citywide events such as open streets. We also had a presence at more than 180 educational sessions, and that was a little bit more structured. So think of it almost as a classroom setting or a workshop where there's a smaller audience and you're really almost kind of like a one-on-one teaching people about sugary drinks. And some examples of this include one of our partners, St. Mary's Health Clinics, did more than 30 sessions at Risen Christ Catholic School during their fitness clubs. They also did classes with their Women's Diabetes Prevention Program and incorporated sugary drink information into all nutrition consultations through the St. Mary's Health Clinics and the Ecuadorian Consulate. In addition, all of our clinics that we're working with, such as WIC, Children's Dental Services, utilized our display boards and our materials to talk with their clients that they see every single day. We also achieved a lot of environmental changes. 22 organizations developed and adopted healthy beverage policies that specify the type and size of beverages that can and will be served or sold within their organization. An example of this is one of the organizations we're working with, Hmong American Mutual Assistance Association, incorporated beverage standards into one of their charter schools, New Millennium's wellness policy, and their beverage standards exceed the federal standards. So that was one of our special success stories with the policy. In addition, we have 14 organizations that have adopted practices that are kind of more informal than a policy, but practices to continue to help promote healthier beverages. So for instance, one of our partners, St. Mary's Health Clinics, now only offers chocolate milk in their schools on Fridays. We have 2 restaurants that we've worked with that have decreased the amount of sugar in their in-house made beverages, in one case over 40%. And we also have youth groups that have worked to make changes, such as changing the covers of vending machines at the MLK Park and Recreation Center. One of the organizations we worked with created unsweetened tea to serve to their clients instead of sugary beverages. And many organizations are no longer using pop during fundraisers. One thing that happened through this campaign is an organic partnership with the city's Public Works Department and working with their Minneapolis Tap Program. And this was really important to us because not only did it support the city's recent recognition around sustainability and climate change, but Minneapolis does have one of the best tap waters in the nation. And in many communities, there is this fear around drinking tap water, specifically in culturally specific communities. And in promoting a behavior change, we wanted to give someone, in saying, don't choose sugary drinks, choose a healthier option. We wanted to get even more specific than that and promote Minneapolis tap water. And besides the reasons for being safe and clean, it's also economical. For many community members, they spend so much money on water bottles and filling like Culligan coolers when they could just drink water from their tap. So some of this partnership really entailed cross-promotion on our media, so through radio, but also conducting tours of water plants. And Councilmember Blanc Yang, who's also very supportive of this, recently conducted a tour with members of his community not too long ago. The article was just printed maybe about a month ago. So, and many of our partners have done the same, and that's been a highlight for many community residents. So we wanted to give you an opportunity to hear kind of from the boots on the ground and hear from 2 of our partners who've been out in the community implementing Rethink Your Drink. So first, I want to invite Mary Lagarde from the Minneapolis American Indian Center.
Good afternoon. Welcome.
Good afternoon. How are you?
Fine. How are you?
Good. Which one is that? This one? Okay. Sorry. Good afternoon. My name is Mary Lagarde, and I'm the Executive Director of the Minneapolis American Indian Center. I've been there for just a couple of years now, but within the community for probably about 25 years. So it's been a while. So with with the Rethink Our Drink, here at the Minneapolis American Indian Center, what we really found was that, we really needed to make a larger impact on the community. And, as one organization, there was just so much that we could do. And so with that, we really looked at, some of the health disparities that have faced our community. Within the American Indian community, we have completed a project through the NB3 Foundation, which is the Natoa Begay 3 Foundation. And with that, really looked at some of the barriers that that the youth and their families felt that were preventing them from being healthy. So it was lack of knowledge. It was lack of access to affordable, healthy foods and knowledge of how to prepare them. And then lack of access to affordable options for physical activity. And lastly, the expectation that chronic health diseases are inevitable for the community, which is very disturbing. That's what our youth, that's what our families think. What we found in the Native Strong project, in our final report that was just completed in September, was that of the 100 youth that we did health assessments on, 41% of the males and 37% of the females were normal or underweight status, and the rest were either overweight and or obese. And really, this really points to a larger problem that we have within the American Indian community. And with Rethink Your Drink, it makes a lot of sense for our community to adopt this. So what we've been doing at the Minneapolis American Indian Center has been working on the policy piece, where other organizations have been working on activities with youth. So for the policies, us at the Minneapolis American Indian Center, as well as 5 other Native organizations have been working on these. And those include the Division of Indian Work, Dog Soldier Academy, which is a mixed martial arts gym, Little Earth of United Tribes, the Minnesota Indian Women's Resource Center, and then finally the Native American Community Development Institute. So as organizations, we really have the capability of making a large impact on our community and really changing the health status of our Native community. So we have been working together to develop and to implement policies. I have been working with the individual organizations and really working on their policies so that they fit their organization. Not everybody's is the same. It's really going to have a rippling effect on the community. So it's not just the participants that utilize our services. It's our staff. It's other organizations. It's other staff of other Native organizations. And the policy for the Minneapolis American Indian Center is our policy is being applied to all sources of beverages that are coming in. So it could be not just our staff meetings that we have. It's not just our activities that we have for our own programs within the center, but it's anybody that's coming in and using our space. So if any of you have ever been to the Minneapolis American Indian Center, you know that it's a very large gathering space, not only for the Native community, but for other outside community members that decide to rent the space. So what we've done is incorporated our healthy beverage policy into our building use contracts so that anybody using our space is made aware of our beverage policy and will sign off that they're going to adhere to that policy. If it's not followed, then the next time that they may want to use the space, we would have to go back over the policy with them and decide whether or not they would be able to utilize the space. So that's at the Indian Center. Like I said, the other organizations, it's really depended on what their staffs have desired. For us, we put it to a vote for the staff of how strict do you want our policy. And our staff, along with the majority of the organizations that we're working with, all opted for stricter policies. So no pop, not even if it's low cal, no cal, but really just sticking to water, coffee, tea, and then juices that are very small in quantity. So that's what we've opted for. Others have opted for that. There's other organizations that have vending machines, and we've been working with those organizations so that they can find vendors that will provide healthy beverages, because not all vendors want to do that just because of money. So, really, what we've been able to do is really create a movement within the community. And it's something that has really been growing within the American Indian community, because we know that we have to do something to address the health disparities that have affected the youth, have affected our families, have affected our elders. And so what we really hope is that we're able to grow the Rethink Your Drink campaign, so that it's not just the 6 organizations, that it's broader than that, that we reach more individuals within the city, within the county, maybe within the state. But just really regrowing the Rethink Your Drink, and, the possibilities are endless. So thank you.
Thank you.
Thank you, Mary. I also now want to invite Carl Lobley and Christy Deshane, I hope I said that right, with the Backyard Initiative.
Good afternoon. Thanks for being here.
Good afternoon, yeah.
Good afternoon.
I'm Carl Lobley with the Teens Chat Backyard Initiative.
And my name is Christy Deshane. I am the Community Health Improvement Coordinator, at Alina Health. So a little bit about the Backyard. We are a partnership between Alina Health, the Cultural Wellness Center in South Minneapolis, and then the residents of South Minneapolis, really focused on improving the community's capacity to take care of its own health. And the way that the Backyard does that is through Citizen Health Action Teams, or CHATs, which are community-led health improvement projects, all organized around a specific population, health-related issue, or approach. And the Teens Project is an example of one of those chats. It's our youth-led chat in the Backyard Initiative.
So based off of the community needs, the Teens Project was asked to choose some target areas that would benefit from the information that I had to offer through the Rethink Your Drink campaign. And one of the locations we had chose was Phelps Park. One, because we had a lot of prior relationships to Phelps. But when we got there, we kind of started to notice, and myself, I actually did research into this. There weren't very many healthy drink alternatives offered in our community. I live in the area, and corner store markets, SAs, they had huge selections of pops and things like that, but water, that's not really appealing to the young people. So at Phelps Park, we were working with a group of 10 young people, and one of the key things that stuck out to me was once we gave the kids this information, they really were able to apply it to their own life, and even pick out instances in their past where they could try to add this information in and improve their health based off of now I know that there's water, and now that I know that water is more healthy than Gatorade, you know what I mean? Even though Gatorade has been told to be a healthy product, that water was better. So a lot of them were talking about, me and my friends are going to drink water instead of Gatorade when we play basketball. And to me, that was just showing that the kids were able to actually apply it to their lives.
Mm-hmm. And so in addition to the kind of in-depth health activity that the Teens Project did at Phelps Park, the Backyard Initiative team members also tabled 2 days at the Midtown Global Market, which has just a really diverse group of visitors. And similarly to what Carl just mentioned, we were just really impressed with the level of engagement and how interested community members really were in speaking with the team members. One example is a Somali restaurant owner, actually, after speaking in depth with one of our team members, requested some Rethink Your Drink posters to hang in his restaurant. And he was really interested in just continuing to educate community members. So in terms of the outcomes of the Backyard Initiative's Teens Project members, 50 community residents signed up on the Rethink website as campaign supporters. And then about 100 Midtown Global Market visitors actually stopped and spoke pretty in depth with the Teens Project members. And 10 children, as Carl mentioned, participated in that in-depth Phelps Park learning activity. And as we've said, we were just across the board so impressed with the way that community members were able to take the Rethink Your Drink information and really apply it to their personal lives.
As a community member, I think the hugest impact that we were able to make was due to that we kind of are from the area and we are residents, speaking to residents about their health instead of it coming from like a doctor or you know, some health provider telling you. It was coming from the people that they're regularly seeing in their days. And I think to continue this work that the Rethink Your Drink campaign has started, I think we need to continue to raise awareness as well as kind of invest in the community to do this work. I mean, like I said, it's easy for a health provider to tell you you're sick, but for a kid to tell you, hey, water's better, it's a different conversation, I guess. Yeah.
All right, so thank you very much.
Thank you.
Thank you, Carl. Thank you, Christy. So in terms of what's on the horizon for Rethink Your Drink, we definitely want to continue our efforts in specific communities, but also expand to the East African population, hopefully sometime next year. We're also exploring partnerships with the University of Minnesota and also the American Heart Association, who happens to have sugary drinks be one of their top 3 priority areas to address as well. So there's a lot of overlap there. We also want to broaden our partnerships with public partners such as the Minneapolis Park and Rec Board and Minneapolis Public Schools. And lastly, we've done a lot of awareness raising at the city level through the city's wellness committee during the summer, and many of you may have seen emails and some posters in different places. But we also want to now start thinking about ways in which we can improve the city's beverage environment. So some ideas or potential options could be through vending or the new City Hall restaurant. I think there's a lot of possibilities that we can explore. So as we talked about, we've done a lot of awareness raising, and that's been our primary focus. And also our focus has been on changing policies at the institutional level. But beyond this, there's such a wide variety of activities that are happening across different states, different counties, and different cities. And this really demonstrates the national momentum around sugar-sweetened beverages. There have been a lot of similar awareness-raising campaigns throughout the nation, and one of the most recent ones in San Francisco is called Open Truth. And in addition to raising awareness about the negative health impacts of sugary drinks, what they're really aiming to do is expose how the beverage industry targets young people and communities of color through their marketing. Many have pursued warning label laws, such as California and Hawaii. Both have tried to introduce a soda warning label, which would read, drinking beverages with added sugars contributes to obesity, diabetes, and tooth decay. And the rationale behind warning labels is similar to the warning labels on tobacco products. Unfortunately, all of the efforts have died in committee, but there's a lot of momentum still around why they want to have warning labels on sugar-sweetened beverages. In terms of creating healthier beverage environments, as of June, I think 2015, San Francisco actually unanimously approved legislation that will target advertising of sodas in the city by requiring health warnings on all posted ads throughout the city. Second, by banning ads for sugary drinks on public-owned property. And third, by prohibiting the use of city funds to purchase sugary drinks. Another thing that Davis, California has done is passed an ordinance that would require restaurants to make water and milk the default beverages in all kids' meals. And lastly, Many states and cities have worked to enact a tax, and revenue from such a tax would be used for obesity prevention efforts and other chronic disease prevention programs. Examples of some states include California, Connecticut, Hawaii, Louisiana, and Vermont. And Berkeley actually became the first city in the country to levy a tax on sugar-sweetened beverages, and it passed with 75% of the vote. There's also a movement internationally for taxing, as Mexico has a tax on their sugar-sweetened beverages as well. And lastly, the Navajo Nation Council established a Healthy Dine Nation Act that requires a 2% sales tax on items that are not nutritionally dense, which includes sugary drinks, and also gets rid of a 5% tax that existed on healthy beverages and healthy foods. So there's a lot going on, and I don't think there's one right answer, but there's a lot of options to choose from in terms of what's going on throughout the nation. We really want to thank some folks in contributing to the success of this campaign, and we really want to thank our city's communication department. Without them, we wouldn't have been able to do a lot of our communication activities. We also want to thank Human Resources and the city's Wellness Committee that helped implement this campaign at the city level with city employees. We want to thank the Public Works Department and their collaboration with us with Minneapolis Tap, the Minnesota Department of Health for really providing the resources to make this campaign happen, and of course, all of our partners who are really in the community and day-to-day implementing this campaign. This is my contact information if there are any questions, but I also would love to drive you to our website, which is rethinkyourdrink.minneapolismn.gov, and also our Facebook page if you want to like it. Thank you so much.
Thank you very much. I appreciate it. And we may have some questions and discussions, but I'm curious about the grant and the funding, and you talked about kind of next steps and more work that's going on. So do we have another year of Rethink Your Drink funding that's going to keep this public awareness campaign going?
Yes, so this Rethink Your Drink campaign was again through SHIP funding from the Minnesota Department of Health, and we've integrated Rethink Your Drink into the next round of SHIP, which will begin November 1st of this year. And our primary goal